one of my biggest things when working with endurance athletes is making sure that they're doing enough relaxation type exercises to complement all the load that their body is taking.
Hey, welcome to the Bodies Built Better podcast. I'm your host, Jackie Tan, and I want to say thank you for joining me today. This show is all about human performance. So whether you are after a PR in the gym or out in the pool, or whether you just want to try something new and challenge yourself, this show is for you. I chat with experts, athletes, coaches, and authors on all the best tips, tools, and strategies to help you perform at your best. We explore the body's incredible ability to heal, adapt, and evolve so you can crush limitations, reconnect your body and mind, and discover your extraordinary potential. And today on the show, I chat with physical therapist Dr. Jessica Warnecke on a topic that doesn't get too much attention, but is incredibly important, not only to athletic performance, but our everyday lives, and that is pelvic floor health. We cover so much in this episode: what the pelvic floor is, what it means to have a dysfunctional pelvic floor, how it is impacted by your training, whether that's running, cycling, or weightlifting, and what you need to know to manage these different types of training loads. This was such a great chat, and it's one of those topics where we could literally talk for hours. But Dr. Jessica is brilliant in explaining everything that you need to know in under the hour. So let's dive straight in. This is Dr. Jessica Warnecke on pelvic floor health. Dr. Jessica, thank you so much for chatting with me today. Welcome to the Bodies Built Better podcast.
Hi, Jackie. Thank you so much for having me. I'm so excited for this discussion.
Yeah, me too. Well, we're talking all about pelvic floor health. And I feel like it's one of those things that people only really think about it if they're in a Pilates class, or they think they don't need to be thinking about it unless they're pregnant, which is completely not the case. And I'm excited to talk more about that today with you. But before we get into that, I'd love for you to talk more about yourself and let listeners know about how you got into physical therapy, and why pelvic floor health.
Yes, thank you. So I've been primarily an orthopedic physical therapist. So I went into PT just loving sports, loving to stay active. I was, in probably every sport that you can imagine from a kid on up. So I was used to just moving my body and, of course, getting injured, having to go to my own PT. And so when I first entered, I was like, okay, let's dive into the sports world. Let's help active people, overcome injuries, recover from surgeries, all that fun stuff. And then a few years into my career, I had to take more CEUs, so like continuing education courses and things like that. And I was like, there's an area of the body that nobody ever really talks about. We honestly don't discuss it much in school, and it's the pelvic floor. And I'm like, maybe I'll just take one course for the pelvic floor because I don't really know much about it and I have to take a course anyways. So long story short, I got into my first course, which was like very intimidating. But by the end of it, I was like, oh my gosh, I am so in love with this topic. The information, the education, the techniques we learned in the course were so valuable for every single body type, male, female, whether they're active or sedentary moms or not. Like, I was amazed how much I learned that could literally apply to anybody. And so that kind of just got me into the world of like, okay, I need to learn more. And so I've now taken, years of pelvic floor courses. It's one of the specialties I now offer in my clinic. And it's just such a rewarding area to be able to treat, especially with women, because I just feel like it's getting talked about more, but it's still an area and a conversation that a lot of people don't know much about, especially other healthcare professionals. Like, I will talk to females that are nurses or, nutritionists or things like that. And they deal with women all the time, but they're like, wait, what exactly do you do with the pelvic floor? Like, what is the pelvic floor? So it's like, wow, okay. Even just in healthcare, like we still don't know as much as we should. And so it's just been a really fascinating journey to go into over the last few years and kind of use the information for myself personally, but see how much it can transform the lives of so many people that I interact with. And it's been just a very fulfilling piece of the journey that I've been on. So I love it.
Yeah, that's amazing. And I find it so interesting that, it's not, you're not diving deep into that throughout your studies, and yet it's such an important part of our anatomy and health.
Mm-hmm.
It's
Absolutely.
crazy.
Well, and even at the beginning, before I started, marketing and really treating much of pelvic floor clients, I was like, oh, this is helping my client with chronic low back pain or frequent hip injuries with running, like all of these things where they would get better, but then either the injury would come back or there was still a missing link that we couldn't figure out. And I was like, this is the extra piece of the puzzle that this person has been searching for. And it's just been such a game changer.
Yeah, absolutely. And it's funny you say that because I've seen clients come through, just like you said, with the low back pain, with the recurring hip injuries, and discover later on that it is to do with the pelvic floor. And so, yeah, such a huge thing. I'm so excited to talk more about this.
I
So
know.
we alluded to the fact that it's not just for women and for women who are pregnant. So let's give I guess, a generalized talk about what the pelvic floor is and why it does affect everyone.
Yes, great starting point. So the pelvic floor is like the deepest layer of our core. It's a huge component of our core. And essentially, it's made up of a group of muscles that sit within the pelvis. And these muscles function for a lot of different reasons. It helps with bowel and bladder movements. It helps with just the stability and the strength that the hips, the core, and the legs need. It also helps with circulation between the lower body and the upper body. And it helps with sexual function. And cohesively, it's just something that whether you have, a male anatomy or female anatomy, the muscles are pretty similar and the functions are pretty similar. But typically we see or we talk more about women with pelvic floor dysfunctions because so much of it is internal and so much of it we can't just see, like with day-to-day stuff and with easy things. And so a lot of women tend not to be as aware of their pelvic floor muscles and what all they are helping or not contributing to. And so it's kind of a new area of just exploration for a lot of people. But it's definitely a very important component for everybody to be aware of just because of the role it plays with bowel and bladder stability. If you're an athlete or if you're doing regular exercise and you're doing core work, you have to include the pelvic floor or you have to know how to feel it in order to make sure you're truly getting a well-rounded workout or program or whatever it is that you're doing.
Okay, and then so what does it mean when we have a pelvic floor dysfunction?
Yeah, so that's a broad term to essentially describe that the pelvic floor muscles can't correctly contract and relax. So whether it's a weakness or a tightness or a coordination limitation or a combination of all of it, there's something going on to where the muscles just aren't doing exactly what they're supposed to do. And it leads to limitations with urination or bowel movements or pain with intercourse or weakness with exercise or a number of things like that.
Yeah, okay. So how does this happen? What are the causes that lead to all of these things that could happen?
Oh my gosh, well, we could talk for an hour just on that.
Exactly. Another episode.
In general, I think part of, especially for somebody that's, let's talk about people that haven't had a baby. And so they think, okay, my pelvic floor should be fine. It should be healthy. But think of a muscle that you have in your body that's active with everything, but you've never done anything for it. Like you're not aware of it. You don't strengthen it. You don't stretch it. You don't do anything. Eventually, the rest of the muscles around it are going to be compensating because that muscle isn't doing its role. And so sometimes it's just not being aware of it. And so it's not naturally utilized in, exercise or daily activities the way it should be. Oftentimes too, for women that are heavy into strength training, or even certain types of like Pilates or like bar, those types of workouts, a lot of times they're just not correctly activating their core. And so they're maybe like putting like incorrect pressure, not enough, like not good breathing or not adequate pressure distribution, so that their pelvic floor gets tight or weak that way. And then obviously if somebody has had a baby, whether they have a C-section or a vaginal delivery, the pelvic floor is going through a lot of changes and is affected both during the pregnancy and during the labor, delivery, and the postpartum period. And so a lot of it just comes from not having a good awareness and knowing what to do. So then something happens and you then have to react to it rather than being aware of it, being proactive, and then, preventing things in that manner. So there's so many other, ways that it can be affected, but that's like a very general common way.
Yeah, okay. Well, let's get a little bit specific now in terms of the pelvic floor and sports for the athletes out there. How is the pelvic floor influenced or impacted by sport? And I understand it depends on what they're doing, but let's get a brief overview and then we'll dive deeper into some different sports.
Yeah, great question. So if we're thinking about just, the body moving actively, everything has to work together, right? Our body is all connected. So if there's a limitation in one part of the chain, something else down the link is going to be involved, right? And so I think this is where the awareness of the pelvic floor is important, because you have to make sure that the pelvic floor is supporting the hip and supporting the back and the knees, the feet. They're all working with the pelvis and the trunk. And so oftentimes, whether we're perfect with our training or not, usually there's a little bit of a discrepancy between one side and the other side, or with certain like planes of movement. Going up and down is different than going side to side. And so oftentimes just having a little compensation or a little bit of a weakness, or maybe even a little bit of a stiffness in the hip over the course of time, will travel to other parts of the body and then eventually, lead to either a bigger thing if they have an injury, or just something that becomes a little bit more chronic. And maybe it just starts out nagging and, oh, I can brush this off to the side. But then over the course of months or years, they keep doing the repetitive movements without solving that root cause. And so now their body's like, hey, I need you to listen to me. So I'm going to have more pain, or I'm going to have bigger limitations with what you're trying to do, because I need you to address this whole foundation. And so, yeah, oftentimes it's like, okay, well, if you're running and, playing a sport with a ball and you have to chase it around and it's unpredictable, if your pelvic floor isn't supporting the rest of your core and the hip, and then gradually over the course of time, things are just kind of wearing down a little bit.
Yeah, so how do we know that that could be the problem or that could be the issue? If, say, our hip is getting sore from, field sport or something, how could we then bring it back to the pelvic floor? Is it something that we can feel?
So usually it kind of matches up with some other symptoms, right? So sometimes let's take it purely orthopedic, and let's say you have a nagging hip injury and you go to PT and maybe it gets better, but then you go back to do the sport again and then your injury comes back, or it's kind of like a roller coaster. Or maybe certain things bother it and you're like, okay, I've figured out how to do these things, but then new things start bothering it. So it's like, okay, there's still something missing. That cues us into, okay, we haven't truly identified the full root cause. So we have to look a little deeper, or we have to look above the hip, or we have to look below the hip. And often if you haven't yet seen a physical therapist or a physiotherapist, and they've like typically we'll look at the back and the knees or things around the hip. And if that's still not enough to solve the problem, then, okay, there's something else. Let's go a little deeper. Other scenarios is if there's pain with other types of things, such as using the restroom, wearing a tampon, having intercourse, leaking, whether you've had a baby or not, leaking is never normal. And so those are all signs that the pelvic floor is involved in some way.
Okay. And when you say leaking, is this for both male and female, or is it? Yep.
Yep, it can happen to both.
Okay. All right. Let's dive into. Let's start with running, and I guess maybe the triathlete. I've got a
Mm-hmm.
few triathletes who listen. How does a triathlon or the disciplines of a triathlon affect the pelvic floor and someone's well-being?
Yes. So this is great. Working with any type of endurance athlete, their muscles, oh my gosh, they're awesome, right? They can do so many things. And so one of my biggest things when working with endurance athletes is making sure that they're doing enough relaxation type exercises to complement all the load that their body is taking. And so what I mean by that briefly is things like breathing, certain types of positional hip and low back postures can help isolate the pelvic floor a little bit better. And then also keeping in mind how they're feeling when they're doing each of their sports. So when you're running, you're standing up. Well, how do you feel standing and running compared to sitting for a long time? Because if there's a certain limitation or discomfort with a positional change, that also can cue us into, okay, well, this might be because your hip is in this position, therefore your pelvic floor is shortened here. And so that's what's causing that. So those types of things can cue us into, okay, how much of it is going to be impacting just because you're in that position, or how much of it is a global pelvic floor or functional thing that's going to affect all, like the swimming, the running, and the cycling, just because of how much load and volume you're doing. So always want to make sure that they're adequately getting good relaxation, good lengthening types of exercises into their warm-ups, into their cool downs, into their recovery days. And then from a strength standpoint, every triathlete, every runner, every endurance athlete should be doing something for strength. And if they can be doing unilateral movement, so meaning one side of the body is working separate from the other side, that's really important, as well as working all planes of movement. So you're working side to side, you're working your rotation, you're working up and down. That way the body and the trunk is loaded in all planes of movement, which it needs to do. If it's running, if it's swimming, like our body is constantly twisting and turning. And so just making sure that their training programs are set up for that helps enhance pelvic floor function and just helps the longevity of what they're able to do.
Amazing. And you did mention breathing, which we want to get into a little bit later on. But
Yes, I
before
know.
we do, let's look at CrossFit and weightlifting. What's happening there?
Yes, so this is great too. And I'm glad you asked this question because every body is unique in its own way. So oftentimes we can't just have like certain blanket statements for certain sports because we don't know all the other details about the body. But in general, one of the most important things to be aware of is, are you utilizing your pelvic floor with your movement? So let's take a squat, for example. Are you lengthening it? Are you contracting it? Are those two sequences of muscle movements occurring at the right time with your squat and in coordination with everything else that your hip, your core, your feet are doing? And then if you add a little bit more intensity, like CrossFit, okay, how's your bracing pattern? How's your breathing? How is all of that? Because that makes sure that our pressure distribution is what it needs to be so that our pelvic floor is working with the rest of our body rather than fighting against it, or rather than having like too much pressure building downwards and affecting the pelvic floor in a negative way. And so it's really important to just make sure, like, okay, again, we're doing warm-up types of things or recovery types of things that help lengthen the pelvic floor, so it's not all just strengthening and shortening based exercises. And then we're including the pelvic floor as we're going through the movements, especially for lower body and core movements.
So, can you expand a little bit on what it means to lengthen and shorten the pelvic floor?
Yes. So just like if you were to think of doing a bicep curl, when you're lowering the weight and extending the elbow, we're lengthening those muscles. So that eccentric contraction can occur in every muscle of the body. And so it also occurs in the pelvic floor. But because the pelvic floor sits within our pelvis, we don't see it, and the muscles don't move as far as our bicep does. It's sometimes hard to understand, like, okay, well, how do I make these muscles longer, right? And so one of the easiest ways to do it is through certain types of breathing patterns, because the breath actually helps like expand the pelvic floor in a relaxed way. So we take those tight fibers in the pelvis itself and like slowly lengthen them with the breath. So that then if you were to do a contraction like a Kegel and you're contracting and shortening, we're shortening from that full expansion or from that happy place of where the muscles want to activate, rather than having the muscles just work in this plane of motion and they're just, partially contracting, partially shortening and getting stronger. We want to lengthen them, use that air to take those fibers to the extent of where they can go, and then keep them happy so that they're primed for a full contraction. And if somebody, like, breathing is great and all, but you can also think of certain types of eccentric hip exercises are great ways to also be lengthening the pelvic floor, depending on what you're doing and what plane of movement you're moving through, because some of our deepest hip rotator muscles, like our obturator internus, is a deep hip muscle. And it actually is like part of the pelvic floor itself. So it's that deepest third layer of the pelvic floor. So as we're doing a lot of things for our hips, our core, our knees, things like that, we're also then allowing the opportunity for the pelvic floor muscles to lengthen and just contract better and coordinate better with everything else.
Amazing. Can you then apply that to a squat? What's happening throughout the different phases of a squat with our pelvic floor?
Yes. So I'll give an example that's for most people safe to try. And then again, depending on if you're doing a squat with no weight versus a light barbell versus like a heavy, like that's going to change the pressure distributions that we want in the pelvic floor. But if we're trying to retrain or test to see if we can feel the pelvic floor in a squat, oftentimes we'll cue for people to inhale as they're going down into the squat and kind of like slowly lowering, lengthening, allowing everything to not have to like support with load, but also working in a comfortable range. And oftentimes I'll have people either inhale right before they lower or inhale as they're lowering to, again, use that breath work to lengthen their pelvic floor a little bit. And then as they're engaging their feet and their hips and they're pushing back up to stand, that's when I would cue to exhale through the mouth and think of kind of pulling up and in with the pelvic floor. So that's that shortening contraction. And that's going to help stabilize and, push the body weight up to starting position. So that's a great way for, like, if people are trying this at home, think of like, okay, can I coordinate my breathing with my lowering of the squat? And breathing in through the nose, exhaling out through the mouth, like using those types of cues to help, just so that it makes it a little easier for the brain to understand what it's trying to do. And then you can play around with it and see if you can feel it in your own body.
Brilliant. And let's talk about loading that squat then. And also, because obviously, when you watch CrossFit or weightlifters or powerlifting, they then put in, the belt as well. If you could talk a little bit about loading the squat and then what a belt is also doing.
Yeah. So when we're having a lot of load, whether it's, CrossFit or powerlifting or anything like that, or even just somebody working out for themselves in the weight room and they're increasing their load, the bracing and the breathing becomes a little different. And so again, this is in general because there's a lot of other factors that may affect this. But instead of inhaling and allowing the pelvic floor to lengthen as you're lowering, we actually want to like take our breath and inhale at the top and keep it as we're squatting down, so that that load that we're putting through our spine isn't going to, cause too much pressure through that pelvic floor. In this type of circumstance, we now want our pelvic floor contracting first to help stabilize the core, stabilize like the pressure system, all the way around our body. So all the way around our trunk, at the top, at the bottom, we want that pressure system to be solid, like an unopened soda can. Okay. And then they can kind of, progress through the weight, make sure things feel good. But the bracing is going to be more, and that's kind of where the belts come in helpful. Like they're a good cue because when you're bracing for like very heavy loads, you don't want to think necessarily of sucking in or just pulling the belly button in. You want to think more of like bracing for impact as if somebody was going to punch you in the stomach. And I think that's where a lot of people can find help with the cues of the belt. It's like, I'm trying to feel my core go into the belt a little bit. So I know, hey, I have this solid foundation. And then I want to be sure that I can maintain it as I'm moving. And so that comes obviously, different types of cues, making sure the progressive overload is appropriate for what the body can handle. And then just really getting used to staying in tune with the breathing and with how your body is feeling so you don't do too much too soon and then cause an injury.
Exactly. We don't want that.
Yep.
So then what if the sport or our training that we love so much is the cause of our pelvic floor dysfunction, so to speak? Because, you hear incontinence through running or through, if you're a CrossFit, double unders or something, skipping. So what happens when what we're doing could be the cause or part of the problem?
Yeah, I think that one of the biggest things is if it's painful or not, right? Because if it's painful, we definitely want to recognize that. We don't want to push through a sharp pain or a new pain that either isn't getting better, becoming more intense, or traveling to other parts of the body, because that's our body's way of like really trying to get our attention. Like, quit ignoring me. I'm trying to tell you something for a reason. Now, because I work with a lot of active people, and a lot of active people like being active, working out, running, like that's their thing. So I try, like literally, I'll do everything else in my power
Yeah.
to figure out what we can do besides making them stop their
Exactly. They're
sport
like,
or their
don't tell
thing.
me to stop.
Yeah, they're like, I am not going to do it if you make me. And I'm like, yes, I honor and respect that. We will work around this. So I think that's the fun part for us as professionals. It's like, okay, props to this person. They absolutely love what they do. Let's get creative. Let's see what we can do to either modify what they're doing or supplement with, for example, if it's leaking, okay, I'm going to supplement with what you're going to do exactly before your workout and afterwards. So we're putting your pelvic floor in as good a place as possible, and then teaching you how to better activate that. And then over the course of time, with whatever strength or mobility program we're working on, things will get better. But that way they have little tools that they can use while still staying active. And then in the grand scheme of things, they're working towards that bigger, future uninjured or unaffected self with everything else that we're putting into play. So yes, for anybody out there that is just scared to try PT for their pelvic floor because they think they'll have to stop, if you find a good physical or physiotherapist, they will work with you and they'll work around all of that just to make sure you get better in a good way.
Yeah, absolutely. And you did mention you'd prep them before and after the workout. What does that look like?
Yeah, so again, that kind of is a little bit more specific just depending on like what their exam showed. But for example, somebody that has leaking with, squatting or jumping or things like that, I'll give them a couple of very specific pelvic floor lengthening and probably hip mobility things to do right before they have to go jump or lift their weight. That way, at least their pelvic floor muscles and their hip joints and that area of the body is in a better starting position so that they can more accurately recruit the muscles they then need to use to try not to leak with jumping or whatever it may be. And also to of note, a lot of times with exercise and the leaking or the incontinence that can occur in active people, it's a pretty straightforward and simple solution. It just honestly takes the awareness of a couple of things that are going on. And for many people, just changing a couple of tweaks they can be fine in, a week or two. So for a lot of people, it seems more intimidating than it honestly would be in their body. And I think that's also important to highlight so that it's a little bit more of a motivator to get into a specialist and to work with somebody that can help you. Just know, even if you've had it for years, like the longer you've had it, the harder it is to overcome it. So you don't want to keep pushing it to the side, like address it. It will be easier, and it's not as uncommon as some people might think. It's a very, very common thing we treat. And so we definitely have so many tools that we can help people recover from it.
Yeah, amazing. And you said specifically like things that you would do is the hip stuff beforehand to lengthen it. So is it more common for the pelvic floor muscles to be in a more shortened and contracted state than it is a lengthened and weakened state?
Yes, for most people. And so, like, lengthened doesn't, so people can be tight and also weak. And I think that's an important thing too, because a lot of people are like, oh, well, like I'm really, really tight, so I must be strong. That's not always accurate. And so we do want to make sure that functionally, okay, if you're tight, you might be strong, you might be weak. We need to identify which one it is, because that kind of gears the exercises. But I think most of us, if we have sedentary jobs, or if we do high intensity training or high volume training and we don't do enough for recovery or mobility, it's just easier for our body to go into that shortened state. And even like external things like, stress and stuff like that, that all tends to feed into more of like the pelvic floor tension, the pelvic floor tightness. And so that's why it's more of a common thing for us to treat.
Yeah, okay. So let's talk a bit about pregnancy now and pelvic floor dysfunction or function. What do
Yes.
women need to know either beforehand when trying to fall pregnant and then obviously throughout their pregnancy?
Yes. So I wish every woman could go in and get at least one assessment from a pelvic floor physical therapist before becoming pregnant,
Well,
because
hopefully
I
they do
think,
after this.
yes, exactly. I like tell all your friends. Because I think it's so valuable to know, how is your pelvic floor right now before it goes into pregnancy, labor, delivery, and postpartum. Because if it's in a great place, awesome. Let's do these couple of things to try to maintain that as much as we can. And if it's, limited in certain ways, okay, it's great to be aware of that now and early in the pregnancy, so it doesn't turn into something that's painful or a huge limiting factor as you get farther along in pregnancy. Honestly, the better the pelvic floor is functioning before baby or before delivery, the easier it will be, and the easier the recovery it will be. So it's helpful for a lot of different reasons. And I think too, just knowledge is power with your body. And if you're somebody that's active, you likely are going to want to be active after baby. And so having all of that information is just going to speed that process along a lot better.
And so they're pregnant. I think it's the only time, you'll be loaded 24/7 with growing a human. What does that mean for what's happening on the inside and that pelvic floor?
Yes. So I love it if women, especially if women who are already active, stay as active as is comfortable and as safe for them throughout their full pregnancy. Because I think that's what your body was made to do. That's what their body knows. And so that just helps their body, their whole pregnancy experience, and their muscles stay as healthy as possible. And so yes, we can't obviously, change everything or, do certain things, but if we can keep general strong function that, can squat to the ground or can lift things at home and just like maintain that kind of stuff, again, it's going to prepare the body so much better for that postpartum, when you actually have to pick up your baby or, get used to relearning how to use the restroom and things like that. If we can keep those muscles in a good functioning place throughout pregnancy, meaning you're not, leaking every single time you sneeze while you're pregnant, that's going to help you not deal with as many limitations post baby. And so just that awareness, and things are changing. Okay, let's stay strong as they change. Let's stay mobile as they change. And so that everything is well rounded.
Wonderful. And then what happens postpartum, especially for those who are active and do want to be getting back into training? What are the protocols around getting back into exercise?
Yes. So this is a very important one. And again, if women only have the time to see a pelvic floor therapist once, I would say, as soon as your physician or midwife or whoever you're seeing is clearing you, typically around 6 weeks or so for exercise, you want to be in with that pelvic floor specialist before getting back and doing what you want to do. And unfortunately, at least where I'm at in the US, it's not always a common referral for like, okay, you're cleared for exercise. Okay, go see this professional to help you ease into exercise. And so typically we see women after they've already tried to exercise and then they cause the problem or the pain or the prolapse or whatever it may be. And it's like, oh, your body was actually pretty good when you got cleared, but then it didn't know exactly how to get back to what you were doing because it needs to be retrained how to do that. And so that's where I think it's just so valuable for women to, again, prevent the limitation or the pain or the injury before it happens, and also speed up and enhance the actual recovery. Because if you start from point one and you gradually add on, your body is going to like that a whole lot better than if you go all the way to midway and then something happens and you have to come back and it's more of that roller coaster. The body just doesn't like that. And so patience is really important. Slow and steady wins the race. Like, you will get back to running. You will get back to lifting. You honestly will get back to probably everything you were doing pre-baby. But the better quality that you put into that progression, the easier and the sooner you're going to get back to things.
Yeah, that's so important to go in with that mindset, isn't it? Because especially if you're someone who has, been exercising all your life, at high levels as well, I guess that could play on your mind thinking that, when you get back into it, you'll be at where you were post
Right.
pregnancy, and it's just not the
Yes.
case.
Yes. And it's also interesting to me because coming from the orthopedic world, we see post-surgery patients all the time. And it's a normal thing. Okay, you had surgery. These are the recovery stages. This is how tissues heal. This is your expectation. For some it's 3 months, for some it's 9 months. Like, there's already that kind of protocol laid out. And that's based off of healing timeframes. Well, if somebody's having a C-section, that's a major surgery going through a lot of muscles, yet there's zero protocol about the stages of healing for that. And so it's like, okay, we don't expect somebody that tore their ACL to get back to running in 6 weeks. Same thing if you've just birthed a child. Like, 6 weeks is not your goal. We're not trying to win that race because your body's tissues literally need more time. And I think it's just
Yeah.
such an important thing for people to understand.
Yeah, absolutely. Well, you basically answered the next question, which was C-section versus, vaginal delivery. Did you
Mm-hmm.
want to add anything else to that?
Honestly, it's like people are always like, well, which one's better or worse? Every person is unique. And just because, if you have a C-section, there's nothing wrong with that. You're not damaged in any way. Like, you will still get back to everything that, somebody with the vaginal delivery could. So I think it's important to know, it's like, whatever works for you, whatever keeps everybody healthy, that's the most important. Your body will recover regardless. And either way, you should still see a pelvic specialist because they'll just be able to tailor it specifically to, if there's a scar tissue or, not. So, yeah.
Absolutely. I mean, that's why we see our, physios or, physical therapists for the muscle tears or
Mm-hmm.
injuries. It's the same sort of thing.
Yeah.
So tell us a bit about diastasis recti, the tearing of the abdominal muscle wall. What's happening there, and how does that then affect the comeback to exercise, and what effect that also has on the pelvic floor itself?
Yes. Great question. So, diastasis recti is essentially a separation of the linea alba, so in the midsection of our stomach, and 100% of women have it by the time, like, if by the end of pregnancy, because it's a normal thing. As you're getting bigger, your body's just expanding. And so it's pretty common for us to assess. Oftentimes, I'm sure like somebody's physician would assess it, but if not, if somebody's coming into the specialist, we do a couple of tests to essentially see how wide it is and how deep it is, because that tells us a lot about the severity of it, what muscles may be affected, and how we're going to best retrain and, re-coordinate all of the core muscles to be working together. But because that area of the body obviously is a huge component of just the whole core stabilization concept, if there's muscles not working well in that section, then everything else is going to have to compensate, right? So that might put a little bit more pressure or load through the pelvic floor unnecessarily, or might be a reason somebody has back pain just because they're not fully stabilized. And an important thing when recovering post-baby is to make sure that all layers of our core are working. So we have deeper layers right around our spine, as well as some of the bigger muscles like our rectus abdominis and kind of what people think of as our six-pack muscles, like around the belly button. And so oftentimes with diastasis, people will just see the rectus abdominis area. So they'll like, okay, well, do I need to do crunches? What do I need to do? And we want to make sure that those deeper muscles, so your internal obliques, your transverse abdominis, your pelvic floor muscles, they're all working and engaging and learning how to stabilize before we work the bigger, larger outer muscles. And then we can work everything together. But I think that's why too, sometimes depending on, if you're looking at social media or reading up things, they'll be like, don't do this or don't do this. That doesn't necessarily mean forever. Like you can plank after a baby. You just have to make sure that your deeper muscles are stabilizing well enough so that we're getting everything throughout the core to recover and respond in a coordinated way.
So it's kind of like working, well, you're working from the inside out.
Exactly. Yes.
Wonderful. Okay, so what if someone is listening to this and they haven't been through pregnancy? They're male, maybe, and their type of exercise is maybe the yoga, or they're a Pilates-based practitioner, but they're experiencing pelvic floor dysfunction, whether it's incontinence, maybe it's pain throughout sex. What are the reasons that it could be for them that they're experiencing this?
Yeah. So with those types of individuals, if it's a functional thing versus a pain thing, and there might be a slightly different cause. So for some women that, let's say they're really mobile and they do a lot of yoga and they have incontinence, their muscles might, and their hips and joints might be very mobile and have the ability to lengthen a lot. And so they would want to focus on, okay, well, maybe I'm not engaging and contracting the right muscles in a coordinated way. And so they would want to then make sure, okay, I'm learning how to contract my pelvic floor up with the rest of my core rather than compensating with my glutes or my inner thighs. And sometimes it's as simple as that. Like, okay, everything is great. You just need to learn how to, coordinate these types of muscles. For others, they might have more stress in their life or a past trauma or abuse or things like that, that all can affect the pelvic floor from a tightness standpoint. And so maybe what they do for their flexibility or their mobility is great, but it's just getting the bigger joints around it. And there's like a deeper cause affecting their particular body. Maybe they're somebody that sucks in and, holds their stomach tight all day long. Well, that's putting a lot of pressure on the pelvic floor, and it's not, you're kind of like shortening certain muscles and then not activating others. So some people just have a predisposition to want to stay tight, want to stay skinny, or want to stay stabilized. And that can also lead to pelvic floor dysfunctions. And then, if there's a pain related, oftentimes it's like, okay, is there something that's tight in the pelvic floor itself, or is it the adductors, or is it the glutes, or is it the low back? And if those muscles are tight and causing pain, is it because they're just tight and overworked, or are they weak and not working at the right time? So it's like there can be a number of different factors, but I think once you identify whichever factor you're in, if you're too lengthened and you need to strengthen, or if you're a little bit too tight and we need to lengthen first, then it can be a lot easier for the body to learn how to incorporate that so that it becomes a normal part of the yoga or whatever else from a workout and exercise standpoint that they're wanting to do.
I think it's one of those things like the more you talk, the more you go, holy moly, the pelvic floor is
Yes.
so intricate and there is so many things that can affect it. But knowing that seeing a professional like yourself can identify it quite
Yes.
easily and go, well, these are the protocols, these are the strategies that you need to
Yeah.
do to work with it. And like you said earlier on, that it doesn't have to take too long before it's back to functioning well again.
Exactly. Yeah. And I think honestly, these types of conversations can be so helpful because we don't know what we don't know.
Totally.
And oftentimes, coming from the healthcare professional, it's like we are not always given the most up to date information or talking about everything because there's so much to talk about in the body. So we cannot be experts of everything. But if you hear something like this and you're like, oh, I wonder if this nagging thing might be, caused by this, like that helps open up the avenue for learning a little bit more and really, really working with that specialist to truly figure out, okay, what is going on with your body? Let the expert help you figure it out because for a lot of these things, you can't like searching, doing your research, Google it, all of that are great to give you some information, but it can't really tell you how to completely assess yourself and completely heal yourself because it's not the expert, right?
Exactly.
And so it will hopefully guide you to the right direction with who to talk to. But that's why I think it's so valuable to see somebody, even if it's like a virtual session or just a one session, and then you go from there with your own program. It's like at least you have a little bit more specific awareness about truly what's going on in your body.
Exactly. Google is great, but it's not going to tell you what's happening with you
Yes,
specifically.
exactly.
All right, so we touched on it before, but let's dive deeper into the importance of breathing correctly. What does that even mean for the pelvic floor?
Yes. Okay. So for the pelvic floor, I love a technique. I call it 360-degree breathing because I think it's a nice like visual for people to understand. But when we're thinking of breathing, we want air going all the way around our body. We want it filling up our core and we want it flowing smoothly from inhale to exhale. So typically, if you're inhaling through your nose, a comfortable pace, you're not like really sucking in or like letting your chest come up or your shoulders elevate without that diaphragm moving forward, without that back expanding backwards, without the ribs expanding outwards a little bit. Literally think of filling up your lungs from the bottom to the top and all the way around. And that will put air gently down into the pelvic floor and help lengthen it on your inhales. And it will also help expand that low back and expand those ribs, which typically don't get enough expansion and mobility throughout the day just because of the nature of what most of us do. So it's a great way to literally just use air, fill up our midsection, and it will also help enhance our central nervous system so that if you're somebody that has a lot of tension or stress or anxiety, it's literally trying to promote that relaxation phase. Let's kind of calm the body down. Let's relax the muscles. And that just generally is going to feel good, but then it's also going to help functionally with those muscles, especially if they're tight. And then kind of coming out of it, exhaling through the mouth helps you better cue your pelvic floor to like gently pull up and in as you're exhaling. So the inhales allow the pelvic floor to kind of relax and expand out. The exhales then take those pelvic floor muscles pull up and in, kind of like a light Kegel type motion would be. And that's something where it seems like it would be easy. And for most people, it's a little hard to, you're like, oh, I think it would be easy to breathe into my back. And then you're like trying to like putting your hand on your low back and like trying to expand it. You're like, oh, this is not moving. So I'll tell patients to like practice it in a couple of different positions or with a couple of different cues just to make sure that they get it. But once you get it, you can do it anywhere and anytime you want. And it's just such a nice way to not only feel better in the moment, but to really make sure that you're letting the pelvic floor and those deeper, tighter muscles get the lengthening that they need.
Yeah, beautiful. I really love that cue, filling from the bottom of the lungs. That's such a nice
Mhm.
visual for me. It really, yeah, it really resonates.
Yeah. That's probably something I give almost I don't want to say 100%, but I'm going to say close to 100% of my pelvic floor clients at least once, because even if their pelvic floor is functioning pretty good, usually there's a little bit of restrictions throughout their mid back or their ribs or something like that. But also, too, so many of us deal with little stressors throughout the days, the weeks, the years. And at a minimum, it just kind of helps like reset your body and feel good. And then everything else from a musculoskeletal standpoint is going to feel so much better
Yeah,
when your internal self feels better.
absolutely. There are so many times I'm catching myself either holding my breath or just that shallow top heavy breath.
Yes.
So,
Mm-hmm.
yeah, that beautiful breath in, I'm going to use that now from the bottom of the lungs
Mm-hmm.
up. Perfect.
Yes. Enjoy.
I don't know if this is a silly question, but I was thinking about it because it's something. So clothing. I wear a lot of. I pretty much live in my high-waisted tights
Mhm.
everywhere I go for training and work and whatnot. So I'm wondering, do clothing or tight clothing have an impact on the pelvic floor?
They very much can, especially if it's something somebody's wearing all the time. So if you think of that pressure distribution system, if you think of like a can and it's a closed can, so there's pressure inside. And if you were to squeeze it and it's not open, the pressure has to go somewhere else, right? And so, same thing, if you think of your high waisted pants, they're kind of at our trunk, they're squeezing in with a little bit of pressure. So, unless you're letting it out through your mouth or through the other end, like pressure is compacted. And so, you just have a little bit more going down and up. And, every now and then it's not going to lead to anything. But if somebody's already having limitations with it or not, fully expanding with their breathing or feeling mobile throughout their midsection, that can be another just little factor that somebody could change to make sure either the clothes aren't so tight or you're wearing the appropriate size or you're just not wearing the high waisted things if it's becoming an issue for you. Now, some people can get away with it and they're wearing their right size and then they do the breathing and they do whatever else they need to for the health of their midsection and they're fine. So it's not like you need to throw all your Lululemons
Yeah,
away,
exactly.
but keep those. But something to keep in mind, like don't wear something super, super tight or compressing down if you're having symptoms or if you feel like
Yeah.
something with your pelvic floor might be going on.
Thank goodness. It's only a problem if it's a problem.
Exactly.
That's wonderful. Dr. Jessica, this has been so sensational. How can people find you if they want to get more information on what you do? I know you got some online programs and resources.
Yes, absolutely. So if people are on social media, I'm most active on Instagram, and Dr. Jessica PT is where you can find me. I do a lot of pelvic floor stuff, but just a lot of general tips to keep you active and feeling and moving well. I have my own clinic here in Austin, Texas. And so our website is pacept.com. And on there's a section specifically devoted to pelvic floor. So we have pelvic floor newsletters that are just packed full of information that go out for free. We also have a couple of online programs and things like that, both for postpartum recovery and strength, as well as for those dealing with leaking with exercise. And there's just a bunch of great resources on it if you're looking for more information or if something, piqued your interest and you want to learn more. Those two areas are definitely places you can just get started. And if you are on social media and you have a question, shoot me a message. I try to be as good as I can with responding and just trying to help spread the word of, what I've been fortunate enough to learn over the past few years.
Yeah, and you're doing such an amazing job. I love your Instagram. It is such a great resource. Definitely go check that out.
Thank you.
For our very last question, I always like to give our listeners something actionable they can do straight away. So, what is the most important thing that we can do to keep a healthy, functioning pelvic floor?
I'm going to say breathe better.
I feel
Practice.
like I knew you were going to say that.
Yes, I'm literally sitting here, like as we've been talking, I've been going through my 360-degree breathing. I'm just like,
Brilliant.
we can literally do this whenever. We will have time for this
Yes.
because we have to breathe. And I think that's so important. Like the one thing we cannot go through a day without is breathing. And so if we can just breathe a little bit better, the pelvic floor is going to be happy, and we might not ever have to deal with a number of issues down the road. So
Exactly.
do that if nothing else.
Amazing. Dr. Jessica, thank you so much. This has been sensational. I appreciate your time.
Absolutely. Thanks again for having me. It's been great.
That was Dr. Jessica Warnecke. I urge you, go check her out on her Instagram. She's such a wealth of knowledge and such a great resource for all things training and recovery, and really makes it easy to understand as well and apply it to your body. Also have her links in the show notes for her Instagram, for her website. You can check out her online courses and resources there as well. If you loved this episode, please subscribe to the channel, share it with your friends, because everything helps this podcast grow. As always, I appreciate you and you choosing to listen to this show today. Have the best day, week, month, and year, and here's to a world of bodies built better.